Herbal crystals as curative patterns, a forgotten science. In the early 20th century, an intriguing area of research emerged through the pioneering work of Dr. Rudolf Steiner, his researcher Ehrenfried Pfeiffer, and later, botanist George Bennier. This research, which has since faded into obscurity, explored the fascinating intersection of crystallography, botany, and medicine. Steiner's crystal insights. Botanical crystallization. Dr. Rudolf Steiner in the 1920s developed a method where he crystallized plant sap using a copper sulfate solution. This process revealed unique crystal patterns for each plant species, essentially capturing their signature in crystallized form. Matching patterns to health. With Ehrenfried Pfeiffer, they extended this technique to human blood, discovering that the crystal patterns from blood often matched those of herbs that could be beneficial for the individual's health. This method was used to select homeopathic remedies with notable success. George Bennier's contributions. Companion planting through crystals. In the 1980s, George Bennier, inspired by Steiner's work, began to explore how plants could be matched for companion planting by observing the crystal patterns formed when the sap of different plants was combined in a copper chloride solution. A harmonious or disharmonious pattern indicated compatibility or discord in garden settings. Saliva crystals for health. Unable to use blood due to lack of medical credentials, Bennier turned to saliva, discovering that the crystal patterns from saliva could resemble those of herbs beneficial for specific health conditions. This led to the hypothesis that these patterns reflected the body's need for certain phytonutrients found in herbs. Methodology and observations. Saliva crystal procedure. A slide is placed on the patient's tongue to collect saliva. A drop of copper chloride is added to the saliva on the slide. The slide is left to dry naturally for 8 to 10 hours. Interpreting crystal patterns. Border and center. The border of the crystal pattern indicates the patient's condition, while the center might show unique features. Colors. Clear crystals suggest health. Yellow indicates liver issues and mucus. Black suggests urinary or bladder weakness. Blue tints point to kidney problems. Shapes. Well-defined, orderly patterns indicate good health or strength. Spreading. Undefined patterns suggest a weaker physical state. The decline and potential revival. Unfortunately, this method of diagnosing and prescribing through crystal patterns has largely been forgotten due to its inability to stand up to modern scientific scrutiny, or perhaps due to the transient nature of the crystal slides themselves. However, the concept was revisited in a 2013 study by HeartMath, which looked at changes in saliva crystal patterns before and after coherence practices, hinting at the potential for further exploration. Reflections on herbal medicine. A legacy of wisdom. Herbal medicine, with its roots in every culture worldwide, has proven effective for millennia, even influencing modern pharmacology, where 74% of drugs derive from plant compounds. Future exploration. This historical foray into crystallography and health reminds us that there's still much to learn about the human body, plant properties, and disease processes. It encourages an open-minded approach to integrating traditional wisdom with modern research. While the practical application of crystal patterns in herbal medicine might not be currently viable, it serves as a testament to the depth of traditional practices and the continuous journey of discovery in natural healing.